The World Health Organization, or WHO, warned countries to be cautious about lifting restrictions introduced to curb the spread of the coronavirus and voiced alarm it was taking hold in Africa. WHO Director General Tedros Adhanom in a press conference said the United Nations agency would like to see an easing, but at the same time, lifting restrictions could lead to a deadly resurgence. He said nearly 1.5 million confirmed cases of COVID-19 and more than 92,000 deaths have been reported to the Geneva-based agency. Saudi Energy Minister Prince Abdulaziz bin Salman told a conference of the G20 group of the world's largest economies on Friday that ensuring affordable energy supply is key to facilitating a global economic recovery. Riyadh, Moscow and its allies, which make up the informal OPEC Plus group, had forged a pact to curb crude production by the equivalent of 10% of global supplies in marathon talks on Thursday and said they wanted others to cut a further 5%. The OPEC Plus pact, if Mexico signs up, would see 10 million barrels per day of oil removed, with an additional 5 million barrels per day withdrawn if the United States and others joined. Norway and Canada, both outside OPEC Plus, have indicated they could cut. In 1910, when a contagious pneumoniac plague was ravaging northeastern China, a physician there concluded that the disease traveled through the air. That pioneering of masks by Dr. Wu Liante, a Cambridge-educated modernizer of Chinese medicine, is credited with saving the lives of those around him. A French physician working with Wu, however, rejected putting on a mask. He perished within days. According to Finance Minister, Tunisia secured a $743 million loan from the International Monetary Fund on Friday to help counter the economic effects of the coronavirus. The loan will be extended under an IMF scheme to support countries during the coronavirus crisis. Tunisia has confirmed 643 cases of the virus and 25 deaths. The infection is hammering its vital tourism sector, which represents nearly 10% of gross domestic product. According to a top US medical expert, there will be no return to normal life such as eating out at restaurants, attending a concert or watching a live sporting event until at least the end of next year, because there will be no coronavirus vaccine available until then. There has been a healthy debate in the US about when life might return to normal, as patients wrestle with severe restrictions on movement and economic activity collapses, with millions of people out of work. US President Donald Trump earlier said the coronavirus outbreak had reached its peak and that the US economy was going to do very well. His comments came just after his administration's top economic officials said they believed the US economy could start to reopen for normal business in May. US President Donald Trump said he would make an announcement next week on US funding to the World Health Organization, which he has recently threatened to cut. Trump has gone on an offensive against the WHO, where Washington is the principal funder, accusing it of pro-China bias during the aftermath of the coronavirus pandemic, which began in Wuhan, China last year. The US State Department has homed in on what it says was the World Health Body's failure to pursue an early lead on coronavirus out of Taiwan. According to the running tally kept by Johns Hopkins University, the worldwide death toll from the coronavirus has hit 100,000. The sad milestone comes as Christians around the globe mark a Good Friday unlike any other, in front of computer screens instead of in church pews. Meanwhile, some countries are tiptoeing toward reopening segments of their battered economies. Kuwaiti Health Minister Sheikh Dr. Basil Al-Sabah has asked those who have recovered from the COVID-19 coronavirus to donate their blood so that doctors could use the plasma to treat currently infected patients. Plasma is the liquid part of the blood which carries cells and proteins through the body and contains antibodies that can fight illness. Late last month, a group of Chinese researchers managed to treat 5 critically ill coronavirus patients by administering plasma transfusion, which resulted in 3 patients fully recovering and returning home, and 2 patients' conditions stabilizing. The Kingdom of Saudi Arabia will be allocating $25 million in aid to support the internationally recognized government of Yemen in its fight against the coronavirus pandemic. Yemen reported its first case of the coronavirus in a southern province under the control of the government. Saudi Arabia confirmed that Yemen is particularly vulnerable to a COVID-19 outbreak and that the kingdom would also be contributing $500 million to the UN humanitarian response plan for Yemen in 2020. The isolated camp of Rukban in southeast Syria faces tremendous challenges as it prepares for a potential outbreak of the coronavirus. In this refugee settlement surrounded by desert, months pass without aid. The last major aid delivery was in February of 2019, and residents live off basic food supplies and medical equipment that are smuggled in from regime-held territories. The UN has described the living conditions of Rukban camp as abysmal. Former Lebanese Prime Minister Saad al-Hariri criticized the government over a draft program for tackling a major financial crisis, saying it appeared on course for an economic suicide plan. The draft that surfaced this week included a proposal for a transitory exceptional contribution from large depositors as part of measures to address huge losses in the financial system, among other politically difficult measures. Parliament Speaker Nabih Berri, the Amal leader, is also strongly against any haircut on bank deposits, calling them sacred. The number of calls made using Microsoft's Teams video conferencing software surged 1,000% in March as people collaborated online due to the coronavirus pandemic. It also said a new record of 2.7 billion meeting minutes in a single day had been reached on the platform. Video conferencing has become a must for work and social life as people around the world hunker down at home to avoid spreading the deadly coronavirus. Apple Incorporated and Alphabet Incorporated's Google said on Friday that they would work together to create contract tracing technology that aims to slow the spread of the coronavirus by allowing users to opt into a system that catalogs other phones they have been near. The two Silicon Valley companies make the world's dominant smartphone operating systems for iPhones and Android devices. The technology will first be available in mid-May as software tools available to contact tracing apps endorsed by public health authorities. Twitter co-founder Jack Dorsey said he was committing $1 billion of his personal fortune to coronavirus relief through his philanthropic fund. Dorsey said in a series of tweets he would transfer his equity in his digital payments group Square to his limited liability corporation Start Small, contributing around 28% of this overall wealth. He said, "Life is too short, so let's do everything we can today to help people now." The U.S. Centers for Disease Control and Prevention head said essential workers who are asymptomatic after exposure to a confirmed or suspected coronavirus case can return to work but should wear face masks and take other precautions. CDC Director Robert Redfield, speaking at a White House briefing, described new CDC guidance intended to accelerate the return to work of employees in essential sectors like healthcare. Under the previous guidance, such workers were advised to stay home for 14 days if they were exposed to confirmed or suspected coronavirus cases.